Our focus here at the hospital is always on quality and ensuring that the patient experience and the family experience when they come to our organization is what they want it to be. So very much focusing on that. One of the other requirements, though, that comes through the province through the Excellent Care for All Act is that every hospital in Ontario is required to have a quality improvement plan, and that's a plan that focuses on quality and safety within the organization. And so we've developed one, and there are 4 areas of focus that we're concentrating on this year in terms of our quality improvement plan. One of the objectives that we have is all around access, and that would be from the time a patient is admitted in the emergency department, so when the physician actually writes the order to admit the individual, to the time they actually make it up to the floor and are in their bed. So that's one of the times that we are monitoring, and we report to the Ministry of Health. Our performance last year was 5.25 hours, so 5.25 hours on average to get a patient from the emerge up to the inpatient department, and we're hoping to maintain that. The other area that we're looking at is patient satisfaction with discharge information that our staff provide them when they're discharged, ensuring that the kind of information that they're getting is what they needed in order to be able to manage at home and to avoid readmission so that they knew what to do and what to follow and who to call. Another area that we're looking at is our discharge medications. To make sure that there is a proper list that's being put together so that the patient can take that medication list home with them. And we're looking to make sure that 80% of patients that are discharged from Muskoka Algonquin Healthcare actually have that list available to them when they go home. And the last area is around monitoring, managing, and putting in any remedial actions that might be necessary around workplace violences that are reported by staff. So at this point, our plan is really around understanding the frequency of these occurrences, just monitoring it through the year, and then developing a framework and action plan around that so we can mitigate those. But I should say that in the past, and this year is no exception, we've worked very collaboratively with our patients and with our community and other care providers, such as the family health team, to develop similar quality improvement plans, so we share them.